Okay, this is an essay on healthcare disparities. Healthcare disparities are basically things in the workplace where certain groups of people are being treated not as well as other groups of people. This can happen through the doctors, or it can happen from the patients themselves, like their subconscious, them not allowing them to get the right amount of care. Uh, where this comes from is basically the way our society is set up. Certain people have more rights and get more power, and there are ways to stop this. This can be stopped by more diversity in the healthcare system and having certain groups that don't have access to certain healthcare help them get access. There are many ways in which the disparities can come about. One of the ways is gender. So this can happen a lot when it comes to women. Certain things they need are not taken accounted for. If you have a male doctor working with a female patient, then they're gonna look at life from a male perspective and might overlook some things. There are like beliefs about women that maybe certain things don't happen to them. This can happen like in cancer, myocardial infarctions. It can be believed that women are at lower risk for certain health problems, certain heart problems as well. And because that's a widespread belief, they might not get tested or qualify for clinical trials. And there are a lot of dark consequences to this. They have a higher likelihood of not making it out of the disease. And doctors also might not tell women about the risk of certain diseases because it's believed that they're not at risk, so they're not told. Sometimes signs are interpreted wrong. It seemed like a woman has this, so they don't get the sign. There are like societal stereotypes, like women are often mothers, caregivers, so they tend to ignore their own care, and that, and because of that, they're at a higher risk for illnesses because they're not getting checked up on. They don't have someone to take care of them. If we want to fix this, we need to teach doctors to not discriminate, to be unbiased. We should help women advocate for themselves, argue for what they need and the care that they need. Acknowledge the differences between men and women, but not see one as less than. Have women specific research on how symptoms affect women distinctly instead of just people overall. And there should be guidelines in how to treat women patients in the particular way that they need. There are also disparities when it comes to race. Um, a certain denominator of people, such as black men, are have it worse for prostate cancer. This happens in many ways. There are like historical mistrusts of the healthcare system. There's like the Tuskegee trials, which that trauma is passed down, so it's believed in black community that they might not want to trust the doctors. They might not know about the disease and not know how to sign up for things like trials. And they might not know that trials are happening. They and if they do see trials, they don't see themselves, so they don't see themselves as a part of it. There are doctors who are biased as well. Certain treatments they might not recommend to a black man compared to a white man. There are different, uh, there are historical myths that black people are inflicted with less pain. For example, higher tolerance, less risk of injury. There is a financial deficit when it comes to black families. They might not be able to afford healthcare. There needs to be gene testing for black people specifically because they are at risk for different things in other races. Some ways that can help them get tested is if people that they trust are telling them, maybe their family or their wives. Doctors also need to learn how to communicate on a cultural level instead of just a general level, to increase accessibility for the treatment. It needs to be closer since a lot of black families are lower income. They might be in places that are not close to a hospital. So there needs to be a way to for that care to get to the patients. There needs to be teachings of medical terminology and comorbid comorbidities. There needs to be more diverse doctors so that cultural connect is there. Have centers in the community to teach about the risk. And there needs to be access to like remote visits, like telehealth. There needs to be programs and fairs, and you can have people from the culture talk about awareness so you can end up saving lives. Another disparity that is not often taken into account is the age disparity. If you're an older woman, you're at higher risk of dying for cancer. And this is not because of natural causes, it's more because doctors try to avoid overtreatment with older women, which can result in undertreatment. There's a delayed diagnosis. They're trying to see if the problem is something else. They need unique treatments for each individual. Another minority that is negatively affected are people with disabilities, developmental disabilities, which are mental or physical ailments that come in when before you become an adult. There are many people with special needs and they are in need of service. There are more people with developmental disabilities. They're living longer because premature babies are surviving more, and just medical science is a lot better. Also, they often have mental health problems, so they need to be treated in that way, in that particular way for that as well. A way that they're treated wrong is that they can become institutionalized if they don't have access to providers. They can be left unattended. They might not have enough money to take care of them, have someone in their life that can take care of them. Another group of people who are negatively affected by disparities are LGBTQ, which are sexual minorities, lesbian, gay, bisexual, transgender, and queer. Often, LGBTQ people have worse mental health and are at high risk of depression, abuse, and suicide. They are at risk of things like cancer and osteoporosis and obesity, HIV as well. With transgender people, there are high rates of self harm and suicide. These things are a result of a society that has a negative effect on this group of people. And this happens not only just in society, but in the medical place as well. There's a discrimination in interpersonal violence and lack of medical insurance. There is if you are a trans man or of a non binary identity and you were born as a woman, you might not get screened for breast cancer because, or be able to get OBGYN care because you're not seen as a woman, so you can be rejected. Many trans women are in prostitution, so that puts them at risk for a lot of things like diseases and being abused. LGBTQ people are at risk of bullying as well, risky sexual behavior, suicide, family rejection, and homelessness. They're also very likely to be abusing drugs as well. And if they've been ostracized from their family when they get to old age, they don't have anyone to take care of them. They isolate themselves and are at fear of being discriminated at work or against people. Overall, healthcare disparities are a big problem in the healthcare force. It can be fixed by diversity, knowledge, and educating people on the fact that they're happening. It also can take the patients that they need to see what holds them back in their lives from being able to get health care, like what they're doing personally and not just what the world is doing to them. And even if you are not a minority, you should be able to help because you don't want to live in a world if they're always focusing on helping others, it can negatively impact your life as well. You should also be love your neighbor and try to help people as well. Okay, thank you very much.